the way it's different is we're going to start by listening to you, right? We want to hear your story. You're going to fill out a 45-page intake form to just start the process, right? So that's a huge difference. It'll probably be the most thorough intake form you'll ever have to fill out. It's extremely comprehensive. We get really deep into your medical history, into your social history. We want to get as much information as we can from you because, you know, most of the time you're going to tell us what's wrong, right? And a lot of times that's one of the most common complaints that I hear about the conventional system is that people don't feel heard. You know, they feel that their doctors they didn't listen to them. They didn't hear their story. They just kind of, you know, they just go off of some basic test results and some symptom patterns, and that's pretty much it. And then, you know, we start throwing darts and trying to hit the target in the dark. So we're going to start by listening to you. We want to hear your story because that's the most important part of this, right? We need to know what's going on. Then, based on that information, we'll determine the testing that we want to do. And once we get those results, right, and that testing is going to be very specific to your situation. That's where we'll get the information on your gut. We'll figure out what's happening in your microbiome, how, you know, the balance in your gut, cellular metabolism, how your cells are producing energy, are you making neurotransmitters, are you detoxifying properly? So we'll get a lot of information, your hormonal balance, are you metabolizing hormones, are you producing hormones? So we're getting as many pieces of the puzzle as possible so we can put together a more complete image. Now we take all this information based on the history, based on your story, and now with the specific test results that will give us that information on a biochemical cellular level. And now we can really create a robust strategy for you that's very specific, it's targeted so that we can restore balance and function where there's a need. You know, so and by doing that, again, we're nurturing you, we're nurturing your system, we're nurturing your physiology. So, and that's why we're getting the results that we're getting. It's all based on you. It's not based on a cookie cutter protocol for this condition or for this diagnosis, because you can have 10 people with that same labeled diagnosis that have completely different physiological makeups and physiological patterns. So again, that's why it needs to be specific. It needs to be to you. Sometimes, yeah, if you're just shooting in the dark, you may hit the target sometimes, you may get lucky, but why not, again, stack the odds in our favor and get as much relevant information as possible so that we can do the right thing and provide the best options available, the best plan for you.